This video is a description of another paraphilic disorder which we call as sexual masochism. The term masochism is derived from the name of an Australian novelist, Leopold V. Sacher-Masoch, whose fictional characters lovingly dwelt on the sexual pleasure of pain. Sexual masochism is a paraphilia, but most people who have masochistic interests do not meet the clinical criteria for the diagnosis of masochism. According to DSM-5, the person with the sexual sadism must have recurrent, intense, sexually arousing fantasies, urges, or behaviors involving the act of being humiliated, beaten, bound, or otherwise made to suffer, and also should experience significant clinical distress or impairment of functioning. And the condition must be present at least for 6 months. These are some of the facts about masochistic disorder. Masochism appears to be more common than sadism and tend to occur in both men and women. Paraphilic sadism and masochism, that is obtaining sexual gratification exclusively only through sadomasochistic activities, are extremely rare. They generally end up in having sexual relationships and other things, but it is quite common that sexual paraphilic sadism and paraphilic masochism can occur together in the same individual. Consensual sadomasochistic relationships are not uncommon both in heterosexual as well as in homosexual relationships. In consensual sadomasochistic relationship, when I say consensual, it means there are two partners, two adult who are consenting of the act. So in consensual sadomasochistic relationship, there may be a sadist master and a submissive slave, but these participants act out or engage in sadomasochistic activities within the preset limits, that is humiliation or injury. There is actually no injury or humiliation or beating are simply acted out, and the participants know that it is a sort of a game and actually try to avoid actual humiliation or injury. However, some masochists tend to increase the severity of the activity over time, and that is dangerous for the victim. Okay, so this particular slide I have listed out some of the sadomasochistic activities. Sadomasochistic activities include bondage and discipline, and in which a particular person is bound, whipped, spanked, humiliated, or forced to cross dress. It can also include activities such as piercing their skin, applying electrical shocks, and burning themselves, and these are performed by a small community of people within dungeons that are popular in major cities. In these communities, there are women who are called dominatrixes. Okay, these women are paid to inflict pain and humiliation in a sexually charged sense, and most of these members of this community are highly functioning and do not suffer because of their sexual interest. However, there are certain forms of masochism which are much rarer, but however more lethal than what you see here. One particularly dangerous form of sadomasochism is what we call as the autoerotic asphyxia. Autoerotic asphyxia involves self-strangulation, where the person tries to tie himself, and one theory even says that the fact that the person is getting less oxygen to the brain is kind of sexually stimulating, and that could also lead to death. So some practitioners say that these people who have such autoerotic erotic asphyxia have sexual fantasies that are strongly masochistic. That is, when we see such victims, police have found that these people have hung themselves next to sadomasochistic pornographic literature or other sexual paraphernalia. Accidental deaths attributable to this practice have been estimated to range between 500 to 1,000 per year in the US, and which is quite large. So it looks like it's more prevalent than what we expect. This is also more common among women, but men. And that's a mistake there. It's more common among men, but it can occur in women too. I have not delved into the causal picture and the treatment of this disorder. As I told you, it occurs with other paraphilias, and the risk factors that are involved in the development of this disorder is not very clearly presented. Understanding to some extent why people develop such sexual preferences may help in treating these people, but most of these people present such self-defeating patterns and often reject help. So we need to, unless they are brought in by their partners, or or come in touch with a practitioner because of their otherwise lethal. This particular paraphilia does not actually involve a victim. So unless they themselves seek therapy, because it's kind of very distressing for them, then we don't get to. The practitioners don't get to see these people. So this brings us to the end of this particular video, which give you a short description of sexual masochism. Thank you.